So today, we're going to talk about a really serious emergency, one that can hide in plain sight right after an injury. We're diving into acute compartment syndrome, where the real danger isn't the broken bone you can see, but the crushing pressure building up underneath the skin.
And that's a really good question, right? You see a fracture, and all your attention goes to the bone. But what if something way more urgent is happening deep inside the muscle, totally invisible to the naked eye? Let's dig into this hidden threat.
All right, so what is this hidden threat exactly? Let's break down the science behind this pretty terrifying silent emergency. Okay, so acute compartment syndrome, or ACS for short, is what happens when the pressure inside a muscle compartment just builds up to dangerous levels. The easiest way to think about it is like a pressure cooker that has no release valve. You see, the muscle is wrapped in this really tough, inflexible tissue called fascia. So when there's bleeding or swelling inside that sealed-off space, the pressure just skyrockets. And get this, the most common cause is something we see all the time. Over 80% of all ACS cases are actually triggered by fractures. That means a pretty routine injury can spiral into a limb-threatening crisis, like really fast. So as that pressure inside keeps climbing, it starts to literally squeeze the blood vessel shut. Blood can't get in, which means oxygen and nutrients can't get to the muscle and nerve cells. This kicks off a devastating chain reaction that, if you don't stop it, leads to permanent tissue death.
And this brings us to the biggest challenge with ACS. I mean, how do you fight an enemy you can't even see? For decades, just diagnosing this has been a massive problem for doctors.
You know, traditionally, doctors were taught to look for these classic signs, often called the 7 Ps. This includes things like pallor, where the limb gets pale, or paresthesia, that pins and needles feeling. On paper, it seems like a pretty straightforward checklist, doesn't it?
Well, here's the catch. It turns out these signs are notoriously unreliable. A lot of the most serious symptoms, like having no pulse or paralysis, they often show up after the damage is already permanent. Relying on them is kind of like waiting for the smoke alarm to go off after your house is already burned to the ground. And think about this. What about patients who can't even tell you they're in pain? Someone who's unconscious from a car wreck, maybe intoxicated, or just completely distracted by other terrible injuries. In those cases, the classic exam is useless. Doctors are basically flying blind. So it became super clear that we needed a better way. And this is where modern medicine really changed the game, by moving away from these subjective feelings and moving towards hard objective data. You have to, because you're in a race against the clock.
Yeah, you can really see the shift in thinking here. On one side, you've got the subjective Ps, which is really just a doctor's interpretation of what a patient is feeling. But on the other side, you have a direct, objective measurement of the actual pressure inside the muscle. There's no guesswork involved.
The key number they're looking for is something called delta P. It's a really simple but incredibly powerful calculation. You just take the patient's diastolic blood pressure, that's the bottom number, and subtract the pressure that you've measured inside the muscle compartment. If that number, that delta P, drops below 30, that's a huge red flag. It tells you the tissue isn't getting enough blood to live.
And this isn't just some new theory. It's now built right into the official guidelines, like this one here from the American Academy of Orthopedic Surgeons. Let's look at the path for an unresponsive patient, someone who can't tell you what's wrong. The guidelines are crystal clear. When that objective pressure measurement, the delta P, is low, the next step is obvious: go to surgery. The data takes away the uncertainty and points right to the life-saving decision. And the tech we have today just makes this whole process so much easier and more accurate than ever before. Instead of just taking a single measurement, tiny little sensors can be placed right in the muscle to give a continuous, real-time stream of data. This gives surgeons a clear picture of what's happening, literally second by second.
So, once the data confirms the diagnosis, there's really only one effective treatment. It's a decisive surgical procedure that can save the limb.
It's called a fasciotomy. The surgeon makes a long cut through the skin and, most importantly, through that tough fascia layer we talked about. And that immediately releases the pressure. It's like finally opening the valve on that pressure cooker, and it allows blood to rush back into those starving tissues.
And you just cannot overstate how high the stakes are with timing. If a fasciotomy is done within 6 hours, a full recovery is actually likely. But wait longer than 8 hours, and the damage to the muscles and nerves becomes permanent, irreversible. Every single minute matters.
But saving the limb in the operating room, well, that's not the end of the story. The fasciotomy is just the beginning of what's often a long and very structured journey to recovery.
Recovery happens in these really carefully managed phases.
It all starts with just protecting the wound and getting some basic motion back. Then, you move on to some light strengthening exercises. After that, you progress to more functional movements. And then finally, after about 2 or 3 months, the goal is to get back to normal, everyday activity.
And this really gets to the heart of how we think about this condition now. ACS isn't just an on or off switch, a simple yes or no. It's a dynamic process. It's a continuum of rising pressure and increasing damage. So the whole goal of modern diagnosis is to track that progression and step in before it gets to the point of no return.
So we end up right back where we started. The whole challenge of acute compartment syndrome is making the invisible visible. It's all about using objective data, using advanced technology to see the pressure before we see the damage, and turning a silent, hidden emergency into a problem we can actually solve.